this meeting of West Berkshire Health and Wellbeing Board. I'm Councillor Alan McCrow, the chair of the board. And before I start, I'd like to explain for the benefit of members of the public who are watching today that today's meeting is being held in a hybrid format. We have a quorum of board members in the council chamber. I'm joined by Councillor Heather Codling, Councillor Lee Dillon. Do we have Helen Clark? Sorry.
Yes.
Sorry, Helen Clark. Superintendent Helen Kenny, Paul Coe, Sean Murphy, April, and Gary Paulson. Other board members and substitutes are attending remotely, and including Councillor Janine Lewis, Councillor David Marsh, Councillor Joe Stewart, John Ashton, Matthew Hensby, Dr. Janet Lippett, Gail Muirhead, and Helen Williamson and Fiona Werby, I hope will join us. I'd also like to welcome Adrian Barker, and do we have Ian Woloff present?
She'll be attending later.
Okay. So Adrian Barker's with us at the moment. Ian Woloff will be attending later, and they'll be presenting items on the agenda. The meeting is being live streamed via YouTube, so members of the public are able to follow proceedings. Gordon Oliver is clerk for the meeting, and Vicky Phoenix is our Zoom host. Please note that only board members are able to, actually physically present in the council chamber, could take part in voting. So move on then first to the first item on the agenda is apologies. Do we have any apologies, please?
Yes, we do, Chairman. We have received apologies from Bernadine Blees and Dr. Heike Veltman and Sarah Webster. Helen Clark substituting for Sarah Webster, and Helen Williamson is substituting for Bernadine Blees.
Thank you. Move on then to item 2, minutes. Are members happy with the minutes of the Health and Wellbeing Board meeting held on the 28th of June 2023? And are there any changes required, please? Yeah, there be no, everybody appears to be happy, so could I have a proposal they be accepted as a true record, please? Heather, thank you. And seconded? Thank you, Lee. Do I need to vote? Yeah. Could I have an indication, please, those in favour of approving the minutes? Approved. Thank you. Could I move on to the minutes of the meeting held on the 13th of July 2023? Is everybody happy with the minutes, or are there any issues that people wish to raise? Okay, thank you. Could I have a motion that the minutes be approved, please? Heather, thank you. Seconder, Lee, thank you. Those in favour, please. Thank you. Move on to item 3, actions arising. So the board is invited to note progress with the actions. Are there any updates or questions in relation to the actions that members wish to raise, please? Okay, thank you. Shall we move on then to item 4, declarations of interest? Are there any declarations of interest, please? There are no declarations of interest, so we'll move on to item 5, public questions. Are there any public questions, please?
No, Chairman, we haven't received any public questions.
And item 6, do we have any petitions, please?
No, Chairman, we haven't received any petitions.
Thank you. Welcome, Martha. Item 7, membership of the Health and Wellbeing Board. Membership is on an organisational basis, but we have a standing agenda item to note any changes in personnel. Following the council's decision to split the role of Executive Director People, Anne-Marie Dodds has been appointed as Executive Director Children and Family Services, and Paul Coe has been appointed as Executive Director Adult Social Care. So congratulations, Paul. Both will start their new roles on the 16th of October. Also, Bernadine Blease has informed us that she is standing down as a board member. I believe she's a member for the Berkshire Healthcare Foundation Trust. Okay. Do we have any new members from that trust?
We have Helen Williamson as a substitute today, so we have asked for a new board member to be appointed.
Okay. I'm sorry. Oh, sorry.
Helen.
It's a Helen, sorry. I can't see the names from here. So.
Helen Williamson.
Sorry?
Helen Williamson.
Helen Williamson. Helen Williamson. Sorry, I can't see the names on the screen. So, but you wish to say something?
She's on mute. You're on mute. I think there may be a technical problem. We can't hear you, unfortunately. Sorry, Councillor Stewart, can I just check that this isn't a wider problem? Can you just speak, please?
Yeah, I can't hear Helen either.
I hear you. Thank you.
So, Tasha, something we could do.
Do something in the chat.
Perhaps Helen could should put something in the chat that she wishes to say something. Could we therefore move on to
Sorry, just for accuracy, from the 1st of October, Sovereign merged with Network Housing, so they're now called Sovereign Network Group.
Thank you. Okay, can we move on then to item 8, the Better Care Fund? And could I invite Paul Coe to present the report, please?
Thank you, Chair. And this is a bit of an interesting one in terms of presenting it, because technically what I'm asking for is the board's support for this plan. And the plan has already been through jumped through a lot of hoops, the Locality Integration Board, a lot of partner engagement, and indeed endorsement by NHS England. So fundamentally, I would be very, very keen that we don't throw any spanners into the works. But I want to be really clear, an awful lot of engagement has happened with a whole range of partners. And as I say, given that NHS England have expressed that they're content, that's a really important endorsement. You can see, members can see the detail in the appendices. Fundamentally, there's a lot. The plan is the Better Care Fund is extremely important to the ongoing delivery of health, social care services across the full network, across the whole of the district. One of the challenges with getting this right is about balancing the preventative upstream work with the kind of acute settings, trying to make sure that we have a rounded response to the pressure points throughout the, if you like, the journey of a person in terms of health or social care needs. But yeah, fundamentally, I commend the proposal, the plan, as so many others have before me. So hopefully we get support from the board today.
Thank you. Do any other members have any questions or points on this item, please? Okay, thank you. Could I therefore ask somebody to move that we accept the proposal or approve the plan, I should say. Sorry. Heather, thank you. To find a seconder? Thank you. All those in favour, please indicate. I think that's unanimous. Thank you. So that's the Better Care Fund. Could we move on, please, to item 9, right care, right person? And could I invite Superintendent Helly Kenny to present the item, please?
Thank you. Gordon, you happy to share the presentation?
Press the button on the Microphone, oh, it's
Oh,
on.
I think it's on yet.
So perhaps you could move a bit closer.
Let's see if I can move it a bit closer.
Thank you.
Any better?
It's better, thank you.
Perfect, thank you. So if we can move on to the first slide, please. So this is just a brief to the board around the ongoing work with all partners around right care, right person. So this is an information brief for partners. So to give some background, Right Care, Right Person is an initiative to ensure that the most appropriate and beneficial care is given to members of our community who may be experiencing mental health difficulties. And the real focus is to make sure that every call to the emergency services has a response that's appropriate from the most appropriate agency, which of course isn't always the police. So in many cases, police are not the right agency to respond to calls relating to mental health. There are many other circumstances where partners in health or in social care are best placed to offer that necessary help and support. This, just to be really clear, this doesn't mean that the police are going to stop attending these incidents where there's a threat to life or there's serious harm, or where a policing power is needed. We, of course, have got, our clear mission is to protect our communities and will continue to do so. But Right Care, Right Person is more about focused on situations where the skills and support that are required by a person in mental health crisis is not necessarily those of a police officer, and where health or social care practitioners would be much better suited to deal with the issue. I think sort of historically, people who've been in mental health crisis or, in the need of care have been stigmatized by having a police presence deal with it when it clearly isn't a police or a criminal issue. So if I can move on to the next slide, thank you. In relation to the national landscape, so Right Care, Right Policing is a national collaboration between the National Police Chiefs Council, between the Home Office, the Department of Health and Social Care and NHS England. So it's a partnership that's already been agreed, signed off by government on the at the end of July, with toolkits already in place for implementation across all partnerships. There's still some ongoing guidance that obviously needs to be clarified, but there's work in progress for national guidance to be formalised. So if I can move on to just to give you an update of where we are in Thames Valley. So on the next slide, clearly when we are looking at whether police should attend an incident or not, we've got to make sure that we will definitely continue to attend where there's a clear policing purpose, where there's an immediate threat to life, or there's immediate threat of serious injury. And that comes clearly from our legal responsibilities around Article 2 of the human rights, Article 3, our common law duties, and obviously our statutory duties as well. Next slide, please. There are currently, in relation to the Right Care, Right Person model, there are 6 aspects of it. At the moment, Thames Valley are only looking at the first 3 aspects of it. And that is concerns for safety, or we call them the police welfare checks, persons who are absent without leave from psychiatric hospitals, and walk out from healthcare settings such as A&Es. The latter ones in relation to our use of 136 and our voluntary attenders to hospital, for example, there's a lot of work to be done before we'd be ready as a partnership to look at that. So we are just looking at those first 3 at the moment. So in terms of now, when a call comes into police, usually from a partner agency, a call handler now has a toolkit that they need to apply. And the sort of questions they'd be looking at is there a real and immediate risk to life or serious harm? Has a crime been committed? Is there a policing power required? Or is there another agency better placed to provide the support and intervention required? And does the caller from that agency have a more appropriate means in which to deal with that call? So of course, we'll always look at what we call THOR, which is the model we assess most of our calls on. So that's threat, risk, harm and opportunity. So we will apply THOR model principles to understand the threat and risk of harm. So for example, if we had a person in mental health crisis that was on the top of a motorway bridge about to jump off, clearly a direct threat to themselves and also road users, we are obviously going to attend that without question. However, if there is a conditional threat, so for example, somebody with mental health difficulties who said to a healthcare provider that they are going to harm themselves within the next week as a condition if something happens. That's clearly not an emergency issue for us and not something police would attend. So they're the principles that we look at. So when I talked about concerns for safety, we will routinely no longer undertake routine welfare checks for other partners. We will only do them when there's a specific policing power that's actually required. And usually that will be when there's a real and immediate threat to life. So examples of that where we would meet would be if there's to prevent and detect crime, if there is to protect the King's peace or saving life or prevent serious harm. Some of the questions that the call handler will now be asking is, if it's to go to somebody's home address, for example, how do we know the person is home? What's the current risk right now? What steps has the requesting organisation taken to address the situation already? So, for example, has a partner agency already done a home check? Have they telephoned the person? Have they contacted their next of kin? So some simple inquiries we would expect to do before we could assess the threat and what we may need to attend. So examples where we will continue to attend for welfare checks will be a report of a person, for example, who's currently active on social media, threatening to harm themselves, and the caller who's ringing us can see they've got the means by which they're threatening to harm themselves. So quite often we will get a call, say, for example, where somebody's posted a picture of themselves on social media with a packet of pills, threatening to then and there take that. So we would still go to that type of request for a welfare check. The main thing being there's a clear police power. So we've got an immediate concern of that person's a risk to their life. So when we attend that property, we've got powers under Section 17 of PACE to force entry into that property to save life or limb. So it's an example where there is clearly a threat to life and there's clearly a policing purpose. We need to use the power to get into that property to save that person. So an example of when we absolutely still would attend. Examples of where we will no longer attend would be things like a report of a client not attending an appointment and they've not answered their phone. Well, clearly that information, there's not enough risk to say we're going to go around and force entry to their house just because they've chosen to miss a healthcare appointment or, you know, an appointment with a drug agency or something like that. So if we can't establish any more risk than that, that is an example of something we would no longer attend. I think, like I said before, if somebody has stated they're going to self-harm or end their life at a predetermined point in the future, clearly that's not an immediate threat and that's something that is just not suitable for police to attend. Also, if there is purely a medical risk only and the person's known to be at home, it would clearly be for the ambulance service to attend as the first option. However, I would say a caveat to that would be if there was issues with ambulance attendant, then it would be, we'd take a risk assessment and we probably would attend anyway if there's a risk to life, even if it only is a medical thing. And I guess that's no different to a situation we'd have at the minute if, for example, nothing to do with mental health, but we had a cardiac arrest in the street, an ambulance couldn't attend. Well, officers would always attend with a defib and do immediate first aid until our colleagues from ambulance could get there. So it's no different in terms of supporting our colleagues when it's needed. And of course, if there's any risk to our partners, we'd obviously still attend. So if an address, for example, is high risk to colleagues in ambulance because of threats of violence, and that's a known risk, we'll obviously still attend because there's a clear policing need for that as well. So that's where we are in terms of Thames Valley. If we can just pop onto the next slide.
So would you like questions as you go, or shall we wait?
If we could just do them at the end, because I've just got a couple more examples and then that's it. So just moving on to absent without leave from psychiatric hospital. So Thames Valley Police will no longer locate and return absconded or missing patients from psychiatric hospitals in most cases. If a patient's been granted Section 17 leave, there's an expectation that the escorting staff are appropriately trained to manage the patient and ensure their safe return. And if there should be a safety plan in place. If someone does abscond, then in Section 18 of the Mental Health Act, hospital staff have got exactly the same powers as police to return the patient back to the hospital setting. Therefore, there's no requirement for police to have any additional powers to do that. However, there's 3 circumstances when a patient who's absent without leave should be reported to police and we will attend, and that's if the patient is dangerous, So a risk to our public if they're particularly vulnerable and dangerous to themselves, and there's immediacy to that, or if the patient's subject to Section 37 or Section 41, which is hospital orders, so where there's mental health illness and they've been convicted of an offence as well. So there's some circumstances with AWOL where we would attend. And the final one, before I take any questions, was just around walkout from healthcare settings. So if we've got a patient, for example, who is in A&E and they have got capacity and they choose to leave that setting, historically police would have been called and we would have been asked to return them back to the hospital setting. We of course don't have any power to do that if they've got full capacity, and that's something we will no longer undertake unless of course there's still the risk there and there's immediate risk to the public, in which case it's highly likely if they can't be located at their home address they would be treated as a missing person. And they would come under the missing persons policy rather than this policy. So that is, I appreciate, a brief sort of example of some of the things we'll no longer attend. But I'm happy to take any questions. And I know it was sort of to be a bit of a discussion around implications from other partners as well and any concerns.
Councillor Lee-Dillon.
Yeah, thank you, and thanks for that. On the welfare checks, you spoke about other organisations, but what if a resident was to phone in? And I just want to give an example because I phoned in for a welfare check probably about 3 months ago.
Okay.
So there was a camper van that it looked like it had taken an emergency exit off of the road, in the sense of where it was parked. It was just parked right in the middle of the car park at the Castle pub at Donington. The landlord phoned up, couldn't get a welfare check. I then phoned up. The problem is all the camper van, all the curtains were all drawn, so you couldn't see inside. So you had no way of knowing if the person had pulled over because they were having a medical episode, and the police didn't do a welfare check. And well, who should do the welfare? Is it just an ambulance then? Because you've got the potential that someone might have had a heart attack. Is that the route to go to?
Okay, so really different if it's a member of the public.
It wasn't in my instance.
If you've got, it does depend on the circumstance. So if you've got a camper van that has clearly had an accident and it's on its side, of course, police are going to attend. If you've got a camper van that looks like it's just been parked on land, there's no sign of any person in distress, they're not breaking any law, then there actually isn't a fear for welfare as such. You've got there is no fear for welfare. You haven't got a person who's in distress. You've just got a parked camper van. So it may be that they determined that it wasn't suitable and that actually it was just for the landowner to remove the vehicle. So it depends on the circumstance. And is there a person in there? If we firmly believe there's a person in there and there's a welfare need and we can't establish what it is, then police probably should attend. So I guess it depends on a bit more detail about that particular call. But this does apply to partners calling us, not the public. However, it could be that when the public call, we may well refer them on to a more suitable agency, for example. So if in that case you could clearly see that somebody was in there and they needed an ambulance, well, we'd probably direct them to the ambulance service and not to police. Yeah. And
then you said if there's issues with ambulance attendants, have you got a level for that? If they're in an emergency situation, or if it's if they're more than 4 hour response, 6 hour response, when does that level kick in? So it will be if there's a need for an immediate response, an ambulance can't attend. So like the example where someone is for non-mental health, if they're in cardiac arrest, an ambulance can't get there, we will of course go there. If there's a significant delay and a life is at risk, then absolutely we should go there. A good example of that was only about 2 weeks ago, where ambulance were called to somebody in mental health crisis who was self-harming. They couldn't get there, so we went there, and there actually wasn't a policing need for it. It should have been ambulance, but because of their delays, we simply just said, actually, it's the right thing to go anyway, and we covered it. And then the final question, Chair, I don't expect an answer on this, but percentage of welfare checks that result in harm, and also, is there any way of us to be able to track this change of policy to make sure that more people aren't coming to harm as a result of this change of approach? Yeah, absolutely. So I can't
answer the percentage thing. Something I'm happy to take away as an action to look at. But yeah, there's a governance in place around this. So there's an implementation group, which is a force-wide one, obviously, for TVP, which is co-chaired by police and NHS. And under that framework, they'll be doing regular reviews, and we'll be able to get that data moving forward as to what it looks like in terms of what we're attending and the outcome. And of course, we need to monitor if there's any criticality, if there's any cases where police haven't attended and ambulance haven't attended, and the outcomes of those as well.
Volker?
Thank you, Chair. Actually, I was going to, it's essentially the same point that Councillor Dillon's just made. I think that the tracking is really critical. The feedback loop, I mean, I recognise, obviously, you need a clear and formal governance structure in place, but I would like to think also that some of that soft intelligence can come through, because in my service, approved mental health professionals who are obviously attending these things routinely, I'd like that to come through quite quickly in terms of feedback on what they're seeing on the ground. Yeah. So I'd encourage that as much as we can do it.
Yeah, definitely. And I think with that sort of governance structure in place, we'll hopefully get that.
Gary?
Thank you, Chair. Thank you very much, Helen. I can completely see the point of this. How will it feel to the public? Will there be a time delay? Are there protocols between yourselves and those other people that you'll be referring to? So if somebody rings up in a panic, how will it feel to them as opposed to how it might feel now? Okay,
so I would suggest if someone's ringing up in the panic and there's a real immediacy to that call, it probably falls under that first criteria and we would still be attending. I think it's the slower term non-immediacy calls where people will probably initially, the public may feel that, oh, I thought this was for police. I've now got to wait for ambulance and there might be a delay, or it could be that actually we'll refer them to a mental health specialist and it might not be for ambulance. It's not always just going to defer to ambulance instead of police, because a lot of them, there just isn't the urgency anyway. So I think for those immediate ones, they just won't feel it because we'll still be attending anyway.
Ask a supplementary. So it's the definition of panic, I suppose. I might panic in a different way.
Yeah.
My next door neighbour, and I'm sort of in the business, so to speak. So again, how would that be worked out? What's the qualitative decision that's taken? Because actually, I might not be panicking because I'm quite a cool, calm, collected person, but actually this is incredibly urgent. Yeah.
It's difficult to measure, isn't it? But all I can say is with the right sort of toolkit that the call handlers are using, that comes with an explanation as to why we might not be attending and why it's not appropriate for us to attend.
Sorry, and so then if you're not attending it because the toolkit is determined as such, what happens and how swiftly will the other?
I guess a lot of that is the impact on it's the partner agencies, because it's predominantly this is about our partner agencies calling us and asking for a service from police that isn't appropriate and it is more appropriate for them to deal with themselves. So I guess part of this is that long-term view is to look at the impact on our partner agencies to determine exactly that. So that's what we need to review in the long term. But it will be predominantly, it's about partner agencies calling us, not our response to the public. Because when the public call us, that's because there tends to be an immediacy for the police when they call us in the first place.
John Ashton.
So, thank you. I have concerns about this. I have to say, I mean, I think the starting point is what's the problem that's trying to be solved here? I know from my work over the years with different constabularies that the police have been concerned that they might sometimes feel as though they're being used as an ambulance service. So maybe that's the initiative. I'm not sure whether that's correct. And, you know, the issue really for me is that I think there's a naivety about this whole thing because it approaches complexity with the idea that there are simple solutions. And, you know, there's a lot of overlap in functions between the police and other agencies, whether it be social work or fire and rescue or NHS. And I suspect that what's going to happen here is that people are going to fall between the stools. I'm afraid the die is being cast here. and we'll be looking back on this in some years' time and regretting at leisure. The proof of the pudding will be in the eating. But I mean, for me, this has always been about training. And over the years, as I say, I've had conversations with quite a number of different chief constables that I've worked with about what training is in place, not just for new officers coming into the forces to begin with, also the coal handlers. You know, that there is there is still a need for robust training in basic health literacy among police officers. I had experiences at first hand when I was young, when my father had type 1 diabetes, and I was forever being called to the police cell to retrieve him when his blood sugar was low, because they couldn't tell the difference between aggression and low blood sugar. You know, these kind of situations are crying out for rounded police training. So I'm concerned about this. I think the fact that the presenter wasn't able to say how this will be measured in terms of its impact is worrying, because I think we should know straight away. We should know now how we're going to evaluate the impact. We should know that before we implement it. That's what we should know. So thank you.
Thank you. Do you want me to just address a couple of the
Would you like to respond to that?
Say again?
Would you like to respond?
Yes, please. So your first point was around why are we doing this in the first place? So quite clearly, there is a need to get the right care for that right patient at the time. And police officers are not the best agency to deal with somebody who is mentally unwell. It is for our healthcare partners to deal with them. Police, in terms of training, do have training in mental health, because there's times we need to enact parts of the Mental Health Act. And also we will go to jobs involve mental health. We have, and we still will continue to. So there is training for that. However, I think it's really important that we know it's about the community and it's about getting the right care for them. And that's what we've got to be really clear on. Of course, there is an element to demand. And whilst this is about demand, I think it would be wrong of me not to say that, yes, this will impact on police, and we will be going to less cases where we're not the best agency to go. And that will free us up to do that the community clearly wants of us, which is to deal with crime. Sorry, is there a bit of feedback, Claire? So yes, that, you know, the impact will be that it will free officers up to go to crime and deal with things that are a police priority. But undoubtedly, it's about getting the right care for that right person. And sometimes when someone is suffering from mental health, let me just. Do you want to just check?
So, Joanne Stewart, Councillor Joanne Stewart. Sorry.
Oh, sorry. I thought you were still. I thought there was a question that you hadn't answered about measurement. I was just waiting for that.
Sorry, let me just. Oh, that's
just I think it's that you were off mute. We were wondering if you were feedbacking. There we go.
Oh, I'm sorry. Sorry, sorry, would you?
But yeah, so and of course, you know, there's when somebody is in, you know, mentally unwell, police officers in uniform are not always going to be the right agency to be dealing with that. So we know that. So it is, you know, it's not about demand, but clearly one of the benefits of this will be that police will be freed up to deal with crime, which is what our communities sort of would expect of us. Thank you.
Sorry, over to you now, Councillor Joanne Stewart.
Sorry, and to say again, sorry, I thought that there was a further question, so that's why I was waiting, because I think John Ashton asked about measurement.
Yes, so just to comment on that. So within that governance structure that I explained, that's where there will be measurements that will go forth. We're not briefed on that yet and what that's going to look like. They've just set up that structure now. So that's in place, being chaired by police and NHS. So if you want it appropriate, we could set for a review in 3 months' time and give some feedback if that would be appropriate. I think it would probably be
think that would
beneficial.
be.
Yeah.
Thank you, yes.
Yeah, thank you. Yes, it was one of the questions that I was going to ask, and that's why I was waiting to hear the answer. And in particular, feedback from partners will be very interesting. I have family members that work for the South Central Ambulance Service who are also under extreme pressure. And my concern probably is very similar to others that have spoken, that there will be people that will potentially, as I think the words used was, fall through the gaps. But one of the things that is on one of your slides was, and I think it might be you said about police use of section 136, and it says about work is underway to explore health-based triage and mental health ambulances. And I know that other parts of the country do have sort of mental health, I don't know whether they call them ambulances, but mental health practitioners that actually sort of will go to a call if they think it's right. And I just wondered if you could tell us a little bit more about that.
No, not at the moment. It's not in place in TVP, and we're not looking to do it anytime soon. So with that sort of governance structure that's in place, it's something that they will look to do in the future, but we're not doing it as part of this at the moment.
Okay, so when it says work is underway to explore health-based triage, that's not here.
Yeah, not here at the moment, no.
Right, okay, thank you.
They're looking to start looking at it, but I think we're quite a way off in Thames Valley from being in a position to do that. There'd be a lot of work would be required from partners before we'd be in a position to do that.
Councillor Heather Codling.
Thank you, Chair. You talk about your strategic partners, and the obvious ones are obviously NHS, ambulance, fire, local authorities with social workers. Is any of this going to get pushed down to the voluntary sector?
So they haven't been, I don't think the voluntary sector have been briefed yet. They will be invited to the partnership meetings moving forward, but they haven't formed part of the initial brief as far as I'm aware.
Thank you.
We have.
You have been
We've certainly
briefed.
been consulted with these documents probably about 2 months ago.
Okay.
Something like that came through.
Okay.
Yeah.
Okay. Thank you for that. I wasn't aware.
Councillor Dillon.
Yeah, thanks. Have we briefed the care alarm companies who I know push quite a few welfare checks through to the police?
Yeah, I understand they were briefed. Yeah.
Okay.
Now, could I ask, there's a couple of scenarios actually. The first one, a friend of ours was concerned about the welfare of an acquaintance, like mutual acquaintance, as it happens. He couldn't contact him on the phone. He went over to his home, peered through the window and could see the man slumped in a chair. So he called the police and the ambulance, and the police broke into the house and found the man, fortunately still alive, but unfortunately died later in hospital. Would the police still respond in that kind of situation?
Yeah, so I would say there's a real difference between that and what we're talking about here, which is about mental health and people in sort of who are, unwell. So that would be a fear for welfare based on a clear healthcare need, and we would still attend and force entry. However, quite often that call does go to our colleagues in the fire service and they will force entry for ambulance. It doesn't always come to us, I have to say.
Thank you. I didn't know that. The other scenario was recently a lady went missing from one of our care homes, suffering from dementia, not mentally ill, but suffering from dementia. Fortunately, she was found not a great distance away, but in the meantime, one of the care workers had started touring the area in her car. But of course, the council and the care home don't really have the resources to do a thorough search of a neighbourhood. Would the police respond in that situation?
Yeah, again, that's absolutely not to do with right care, right person. That would be a high risk missing person, which would fall into the missing person policy. So absolutely. And usually someone who's gone missing from a care home with dementia would be a high risk. So that would be an immediate police response. So yeah, absolutely. That's for police.
Thank you.
Thank you, Chair. I just wanted to say that we very much support the suggestion of a further report coming back here in 3 months, by which point we'll have a better sense of the impact that this is having. But in the meantime, the Berkshire West Mental Health Programme Board is being stood back up, which I understand TVP are part of. So we'd also request that this issue is discussed there. And again, some opportunity for earlier feedback through that meeting. Yep. Thank you.
Are there any other questions anybody would like to ask? Oh, thank you very much, Superintendent. It's turned out to be a very useful discussion. Thank you. And we welcome to come back and with those statistics in 3 months' time. Thank you. We'll move on, sorry, to item 10, the local response to the cost of living crisis. I'd invite Sean Murphy, who's the service lead for public protection, to present this report, please.
Thank you, Chairman. So the background to this report is obviously the board considered a report in the July meeting. There was a couple of things came out of that, a couple of recommendations. One of them is that we would come back with a report to this meeting. And in the meantime, we would arrange a meeting with the voluntary sector, similar to the one we had about a year ago, in fact, actually, to discuss where we were with issues relating to the cost of living. Also, at the last meeting, there was a discussion about the Household Support Fund, and I did say I would undertake to come back with some more details about how that was being allocated, and those are set out in this paper. I think before we come to the paper, it might be useful to just feedback on the meeting we had with the voluntary sector. So by a bit of luck, this meeting was delayed by a few days, so we were able to have that meeting before this meeting. So I'm in a position to feedback. Otherwise, it would have been the day after the planned health and wellbeing board. So we had a very good turnout. So the meeting took place last Friday of statutory and voluntary sector partners there. And there was, I think, probably there was quite an in-depth discussion around some of the issues, but there were some common themes that came through from the voluntary sector partners, and also, in fact, some of the statutory partners like social services as well, adult social care, and some of the issues that they were seeing in their day-to-day work. So, really, to kind of summarise where we got to in those discussions. And actually, before I go on, can I thank Gary as well for setting this meeting up and pulling it all together and chairing it on the day. But the summary of where we got to on the day was that across the agencies, across the organisations, they were seeing increasing demand at the time when they were seeing increasing running costs. So you have this issue where demand is rising, but their costs are rising, which in some organisations was causing them financial difficulties and challenges. And for example, some of the organisations, they've seen their spend double in the case of a year alone. The next paper on the agenda talks about the implications around mental health, but that was very much echoed in the room on the day, that what they were seeing was a rising, not just from debt, but more generally increasingly complex cases involving mental health related issues. There was an identified and clear increase in the number of people facing immediate indebtedness. So rather than, for example, with assistance advice dealing with cases where people have run up debt, it's real-time debt. And the problems that go with that, and the ability to pay bills in the immediacy, to buy food, and to just basically live in the immediacy from the debt situation. There was a feeling that there was a housing crisis, if there isn't already one. A housing crisis was kind of coming down the line. And in particularly issues around eviction-led scenarios, but also a contribution actually from the council's own environmental health team about some of the issues facing in the private sector housing housing sector around, the state of some of the properties, the challenges that some landlords are facing, the increasing rents as you alluded to at the last meeting, Chairman, and so forth, and all of that really coming together along with increasing mortgage costs and unaffordable rents. There was a debate about the balance, I suppose, between the voluntary sector, the local authority, the spend of the households support fund, and how all of that is coordinated. There was a confirmation from Greenham Trust that there are still grants available to support these organisations, and in fact, actually, a couple of grants were issued, and certainly one grant has been issued since Friday. I know a substantial one to one of the organisations that was there that will assist. But overall, I think the summary was that this issue of the challenges of arising from cost of living and indebtedness have not gone away. Whereas they may have disappeared, I suppose, a bit in the news along some of the headline stuff around headline falling inflation and everything else, for a lot of people, it hasn't gone away. People are struggling, and it is having an effect on health, which is obviously the issue that we'll come on to discuss next. So just to return to the report, I have set out basically how the allocation for West Berkshire was agreed in May this year for the Household Support Fund. I think there will be a debate going forward, I think, arising from the meeting about the balance of the spend in terms of allocation by the council as opposed to working with the voluntary sector. And I think that's probably where we got to, City Leader. So other than that, I'm happy to answer any questions. I think, Gary, obviously you were there. It'd be interesting to hear your take and whether I've missed anything.
Well, I was chairing it.
I know you were there.
Yeah. Yeah. So thanks very much. It was a good summary. I mean, but just I guess reassure the board really of the root of that information, because it wasn't just anecdotal. We had a really good spread of organisations there. So we had the sort of pastoral care type organisations, befriending, faith, family care, sort of home start type organisations, and then the homeless type organisations as well, and those that are feeding people. And a really good spread of statutory bodies there as well to support their evidence, actually. So I was really pleased with the turnout, about 35 people there, and a number of apologies who've now received minutes as well, which they are available to anybody else if they're interested. I've sent them to Lee and others. But I think I think something that also picked up is the impact on business, actually, which your environmental health people mentioned, didn't they? About the lack of funds to be able to sort of keep premises in a good and clean condition as well, impacting there. But certainly, just to reiterate, and I think I'd be failing my duty if I didn't say that there was a very, very strong and pithy view about this household support grant being spent more quickly, and certainly the decision-making process within the authority to be able to make decisions more quickly, as was indicated by the officers there with goodwill.
Yeah, thanks. I had to give my apologies for the meeting on Friday, but just to say, from the administration's point of view, there is absolutely no point us having grant money if we can't get that out to the people who need it in a speedy and timely manner. And I know that Sean and other officers are now working to bring a proposal back to executive members that will see us distribute money to third parties who do have the ability to act quicker than we as a council. I think that's right for West Berkshire, and it's right that support fund is used to give support in a speedy way, but also by working with our great partner voluntary agencies and charitable agencies to be actually deliver better value in terms of the support we give as well. So I'm looking forward to changing the pace on this and delivering for residents quicker.
Chairman, I'd just like to thank you very much. That's well received, Lee. I would like to just request that when those discussions are in place with the other third-party voluntary sectors, that we are included as a matter of course, because with the best will in the world, those particular organisations may be looking at their particular area, and I want to make sure that there are people with getting a shout in from Tilehurst right over to Lambourne.
Yeah, no, absolutely. And you know, we need to solve
standing order just to include us. Yeah.
Yeah, well, you know, we need to support the whole of the district. And actually, the meeting that was convened and chaired by yourself on Friday probably should happen on a more regular basis and hosted by us as the principal authority here to make sure that we're keeping everybody, you know, so that we're looking at it holistically across the piece and not just focusing on one area or issue.
You do host it, actually. I mean, obviously it's there, but it's in the sense that the accommodation, tea and coffee is provided by the local authority. It's our data that gets people through the door, really. So it's a good partnership. Yeah.
Sean, Chair, can I just say that I think it would be useful actually to circulate the minutes because I did highlight them. I was going to go through them, but actually it would have taken quite some time to do that. But I think it would be useful for everybody on the board to see some of the issues from the various organisations. So yeah, I'll get them out to Gordon if you're happy with that, Gordon. We'll perhaps circulate them to the board. Okay,
thank you. Matthew Hensby.
Thank you, Chair, and thank you, Sean. Really welcome a copy of those minutes. One question from myself is I would very much hope the Sovereign was represented at that meeting with third sector organisations, and if not, welcome the opportunity to meet either with one of our team, meet with either yourself, Sean, or with Gary, to ensure that local residents are benefiting from obviously West Berkshire Support Fund, but also the support fund that Sovereign provides to its customers and residents as well within the borough. But really welcome a copy of those minutes to be able to review them. Thank you.
I think now, as you weren't represented at the meeting, and I'm not sure whether there was an invite or not, but we'll certainly make sure that you're represented going forward. But I think as we go forward to review this, it would be useful for you and I and maybe one or two others basically to look at what Sovereign are doing as well. I think the thing that we need to do basically with all of this is to ensure that the little bit like the previous discussion that we had, that the people who are best placed to respond are the organisations that do respond, and that the money is used basically to ensure that the response is quick and agile enough to meet people's needs.
If I may comment, Chair. I'd really welcome the opportunity, Sean, to meet with yourself around that. Disappointed we weren't invited to the meeting. I'd like to ensure that Sovereign, as the primary landlord for social residents in the area, is included in future meetings. That would be very welcome. I believe we have mentioned this in the past. So I'll be very grateful for an invite and very much welcome a conversation with yourself, Sean, or a member of the team around this matter.
Do any other members have any questions or any points, please? Oh, Councillor Stewart.
Thank you, Chair. I'm really pleased to hear what Councillor Dillon was saying about speeding up the process, because I would imagine that certainly in lots of walks of life, if you need something urgently, having to fill out endless paperwork and speak to lots of people can really just, you know, make the whole process even worse. I wondered, Sean, whether we still need to do even more on communication. And I know you and your team have done a huge amount on this already, but to see that 40%, I think roughly 40% of the applications were rejected, and some of those were not eligible or not enough information provided. Is there something more that we think we can do as part of that process to speed everything up? I guess maybe I'm going to answer my own question now. If you're putting it out to other agencies and they know the people that are most in need, then maybe that will actually help with some of this. Would that be right?
Yeah, I mean, you're absolutely right. And in fact, I should have mentioned actually that there is a big communication programme planned now as we move into, I suppose we are into the autumn, but that is being pulled together basically to not just promote the fund, but also to explain to people how it how the fund operates in terms of people's eligibility and everything else. going back to your original point about speed, I mean, there is an inevitable, I suppose, delay to the way that a local authority can deal with something. I mean, we have to process it, we have to set somebody up on the accounting system, we have to make a payment, as opposed to basically somebody, for example, in a voluntary sector organisation may be able to deliver a new fridge or a new cooker in 2 or 3 hours. And we're never going to be able to do that. So this is the discussion that I think will be taking place. And once we've got a kind of model around that, and I would imagine a model around how that is going to be funded, again, that will be part of what's communicated with the public. Yeah, I mean, there is an awful lot of, you can imagine how much time it costs to reject 40% of the applications, and that time could be spent on processing more and processing them quicker.
Thank you.
John Ashton.
Yeah, so just following on from that, my experience in Northamptonshire, where I was working last year, and where as Director of Public Health, I held the family support budget, was that using community organisations and groups and parish councils, I mean, Northamptonshire is not dissimilar to West Berkshire in its rurality, got us very close to people, and you know, using community development workers that we had in public health to identify families was really valuable. We also invested public health money in the voluntary sector infrastructure so that they had the infrastructure to be able to handle all of the family support, but the household support budget. And that worked very well.
Thank you. Are there any other questions or issues that members wish to raise? Yeah. Thank you very much, Sean. Thank you for a useful report. Thank you.
I guess I mean, one question I suppose is really, we've talked about where we need to go. Do we want to come back to the board and discuss the progress on that at some point?
Please, yes. Thank you.
Chairman, just to say, I think we'll schedule a meeting for, say, 8 weeks. See what progress. Yeah. Okay.
Thank you. Can we move on then to item 11, the financial problems and mental health? Could I invite Adrian Barker, who is chair of the Mental Health Action Group, to present the report, please?
Thank you, Chair. The Mental Health Action Group brought a report on financial problems and people's mental health to this board in February, and I think it was well received, but we were asked to go away and have another look at some of the proposals, and this report does that and brings the work up to date. So I won't repeat what was in the original report, and I won't go into detail on what's in here in terms of progress. I'll assume that members have had an opportunity to read that. But there is quite a lot of detail in the appendix on the various areas that we've been looking at, including some further information since the original report. But there were just 3 areas I wanted to highlight, which required the committee's attention. And I'll just quickly go through those. The first was in relation to proposal 4, which was about supporting the Community Mental Health Transformation Programme. And the original proposal was fairly broadly written. It was kind of in line with the direction that the Integrated Care Board is moving, but perhaps a bit wider. So we've, in discussion with the ICB, have tightened that up and brought it much closer to the wording that's in the ICB's joint forward plan. And essentially what it's asking the board to do is to support the introduction of what the generic term is the Community Mental Health Framework being implemented in Berkshire West as the Mental Health Integrated Community Service. And it's really about trying to help people with serious mental illness in primary care in a way which integrates primary care, secondary care, and the help within the community. And to do that by looking at the whole of a person's problems, not just dealing with symptoms. So we felt that this was a very positive approach to dealing with not just mental health and financial problems, but mental health more generally. But you can also see that it has a lot of potential as a model for primary care more generally, helping with people's physical and mental ill health. And indeed, the Joint Forward Plan, the ICB's Joint Forward Plan, talks about developing integrated neighbourhood teams and providing the estate strategies and other strategies to support that, which is very much in line with the way things are developing in primary care and the Clare Fuller stock take. So I hope that is fairly straightforward in the sense that it's asking this board to support policies which are already in place and which the board has seen in agreeing the Joint Forward Plan. The second one was about we were asking the Berkshire Healthcare Foundation Trust to review the extent to which its frontline staff are able to offer basic financial advice and signpost to sources of help. And we haven't had a response on that yet. So just asking the board really if they can just help see whether we can find where we are and what's being done and whether that can be developed any further. And the final one is proposal 10. And this is here because this was something which was raised by the board rather than being in our original report. And it was basically supporting the work Thames Valley Police are doing to try and reduce the extent to which people come into financial problems because of scams. And they are doing a fair amount of work on that. And there's some wording in here as a revised proposal, which hopefully meets the intentions of the board as it was raised. And just, I mean, finally, just a very brief comment on this whole issue. I mean, in many ways, this is just scratching the surface. Some of the things we've been doing are very particular individual things. But what we have tried to do is address the underlying causes of the problems. And inevitably, that means we can tick off individual actions, but there will always be work to be done because these are broad systemic issues. So a lot of these things, the Mental Health Action Group will be coming back to, and some of that is set out in the report. So just hope the board is happy to accept the proposals, most of which are noting the progress. Thank you, Chair.
Thank you. Councillor Dillon?
Yeah, thank you. And thank you, Adrian, for talking us through that. We had a discussion last night at the Joint Public Protection Partnership around fraud because we updated our policy and we noted that we had 12 areas of prevention work that we do within the service, from cold caller zones, right through a plethora of options. But one of the topics that came out in debate was around young people, particularly around social media. And get a quick cash loan here, to get cash in your bank here, which can also be a way into sort of county lines as well. So slightly linked, but different area. But also the growth of AI as a way to persuade people to part with their money. I think yesterday Tom Hanks was in the BBC websites about an AI video promoting some dentistry work. But I'm just fearful that you might see an influencer who gets copied by AI and pushed out to young people as well, which could change behaviours. So we've asked through the JPPP that we give that some thought, and that we also proactively engage on social media channels so that they can see the Joint Public Protection as posted to say, we don't think this post is real. So even if the post isn't taken down, at least they're seeing partner organisations posting on those saying, beware, take a second look. I just wonder if we could build some of that into these proposals as well. Thanks.
Just a point, really seeking some support with regard to the number of sort of work programs that are going on, we're currently engaged in something for BHFT around mental health pathways for the voluntary sector, which we've been working on alongside Adrian and the Mental Health Action Group. But I'm also very much aware that obviously Bob has also got some mental health stuff, and I'm not sure at all that actually the bosses are really aware of what's going on. And I think there is some sort of, well, I'm going to put it no other way, duplication really. Not duplication, but certainly reaching out to the same people with very slightly different aims. But I think we do really need to get this all together. Yeah.
Do you think that's something that should be coming back to this board?
Well, whilst Helen's in the room, really, I was raising it, but within the context of what we're all trying to do and the resources that are always going to be limited, it's just, I do think there should be some serious hand-holding here between Bob and certainly BHFT in West Berkshire at any rate.
Yeah. Sorry, yeah, happy to give that further consideration. I think that's right. There's various different groups and also the programme board that I've just mentioned, which should bring some of that together, but we need to make sure that it does work in that way. So yeah, happy to reflect on that and perhaps pick up outside the meeting if that's helpful.
Thank you. I wonder if Helen Williamson can respond on behalf of the Berkshire Healthcare Foundation Trust. I think it looks like the technology has let that stand. There's a couple of things that I picked up from the report as regarding possibly what this council should be looking at. One is debt recovery, and I'm wondering if that's something that perhaps we should ask the scrutiny committee to look at, and also the council tax reduction scheme, which hasn't been reviewed for some time. And as you point out, some of the rules in there look as if they could have quite significant effects. So I think perhaps we should add to our recommendations here that we ask the scrutiny committee to look at the debt recovery and at the council at the council tax reduction scheme, if that finds approval. Adrian.
Just a couple of points. Just on the Berkshire West Programme Board, just to say that we have been invited as the Mental Health Action Group. We got in contact to see how we could join up the governance a bit better. So we've been invited to that first meeting on Friday. So thanks very much for that. On your suggestions about debt recovery and council tax, well, I suppose more on debt recovery. We've suggested in the report a half-day workshop to look at that and try and share experience. Not that that should be in place of scrutiny committee's work, but maybe we can work with Councillor Vickers to make sure we coordinate what we do on that.
Thank you. Are there any other questions or points? Sean Murphy.
Thank you, Chair. I mean, just say I really welcome this report and the proposals and the breadth of the proposals that are in it and the work that's been done. I know the proposals have been before. I completely agree with the stuff about young people in schools. We had a big debate, as you know, last night about prevention and where we go with basically advice and preventative measures and everything else. And we've learned in so many areas of the work that we deal with within the public protection service that young people are the key to a lot of that. So I very much welcome that. On the issue of fraud, I mean, I can't understate really the impact of fraud on the victims. You know, I mean, we deal with it day in, day out as a service, whether it's what's considered to be, you know, sort of telephone fraud or banking fraud, all the way through basically to people who are victims of doorstep crime and you know, major kind of organised crime areas, and looking at the victim impact statements of those people, and we often do take victim impact statements. The impacts are life-changing for a lot of people. You know, affects family, affects obviously their financial situation, relationships, and physical and mental health. In a way that for some people they just don't get over. I just wanted to make one other observation as well, which is really the connection between finance and housing. and the availability and affordability of the right housing and good housing, and the impacts of not having that, which I think are, again, something that really needs to be looked at. I mean, the levels of overcrowdedness and things like that we're seeing, the impacts of that as well that you get. I mean, a lot of that is about availability, but in some cases, obviously, it's around affordability as well. And then obviously the ongoing impacts on health, and again, dealing with private sector housing. We see this again daily. Comes into our kind of mailbox. And really, just one final observation. I really want to get our service more involved in the delivery against some of these targets. So I'll go away and have a discussion about how we can do that, because actually there is a lot of work that's already going on there that probably hasn't been picked up, because probably we haven't had the discussions that we perhaps should have done.
Thank you. April.
Thank you, Chair. Sean, it was just a quick question in terms of it's really sad to hear about all the people that you're obviously dealing with in terms of being victims of fraud. And you mentioned about obviously that affects their mental health and well-being. Is there a link? Are those people signposted to mental health support? I'm just wondering whether we can link up with your service in terms of that to make sure that everybody that comes into contact with you is signposted to mental health support.
So we do have a small kind of victim support function within the service that we've kept running, along with we do make a lot of safeguarding referrals as well, where that's appropriate to do so. But I suspect, actually, I think probably the point you make is a good one. This is an area probably where we could strengthen this. We've done a lot of training for staff around recognising safeguarding issues, and maybe the staff that are involved in this work, April, we could do perhaps more work to raise awareness of other forms of support as well that are available to them.
Yeah, no, really happy to work with you on that, Sean.
Thank you. But it is, yeah. I mean, it is when you do read, and Helen will know the same. When you read victims' impact statements, it's quite something sometimes.
Thank you very much. Thank you very much, Adrian. Thank you for a very comprehensive, and the group, sorry, for a very comprehensive report. Could I therefore go on to recommendations? So the recommendations I have at the moment is for the board, to commit to supporting the community mental health transformation programme, help make it a success. Should include leading by example, supporting a programme, encouraging its partner members to engage productively with it, and receiving progress reports on the implementation as appropriate. And for the board to support the ICB's objectives, that's the Integrated Care Board, in the joint forward plan and its service delivery plan to continue developing the community mental health framework, build GP-led integrated neighbourhood teams, and develop the state strategies, including participation in public state estate initiatives, and to achieve the objectives. In relation to proposal 5.4, board to request the Berkshire Healthcare representation provides a response to the original proposal. And in relation to proposal 10, for the board to indicate its support for the work on fraud prevention, and that partner organisations spread appropriate messages and links to resources where possible. And could I add to that to ask the West Berkshire Council's overview, is it overview scrutiny still? Just scrutiny committee to take the council's debt recovery procedures into its work programme, to report fairly urgently, I think, and also for the council to review its council tax reduction scheme. Could I have a proposal, please? Sorry?
I think you just did from the chair.
Okay. I will propose to the chair. I'll have a second.
I'll happily second it, but just with the clarification that we don't control the scrutiny's work plan, so it'll be up to them.
So as a recommendation.
Yes, yeah.
Okay. Right. Those in favour, please. I think that's unanimous. Thank you very much. Could we move on then, please, to item 12, changes to pharmaceutical services?
Thank you, Chair. So the report that you will have seen provides details of recent and planned changes to the pharmaceutical services in West Berkshire. So I'll give you some sort of key points from the paper. So we were notified of 2 changes to pharmacies within West Berkshire. And as a result, the Pharmaceutical Needs Assessment Subcommittee met on the 14th of September to discuss recent changes to pharmaceutical services in the district. The 2 things that were discussed were the change of ownership of pharmacy in Pangbourne, changed from Lloyd's to Click Solutions Limited. No change to services provided or opening hours, so no need for the board to take any action on this particular change. The second pharmacy that was discussed was the closure of Superdrug Northcroft Street, Newbury, which closed on the 16th of September. The closure resulted in a small change in essential pharmaceutical services, since these are provided by all pharmacies. In terms of advanced services, they only offered seasonal flu vaccines and pharmacy consultation services. There is still good coverage of these services in the district, so the loss is not considered significant. In terms of other services, Superdrug offered needle exchanges, supervised consumption, and emergency hormonal contraception. Again, there is still good coverage of these services in the district, so the loss is not considered significant. The analysis showed that no additional households were pushed outside of the 1 mile, 20-minute travel time threshold that we use to assess changes. There are 2 other pharmacies within 400 metres of the site, although only Boots is open on a Saturday. Superdrug handled around 5,000 prescriptions, which is less than 10% of the figure for all pharmacies across Newbury. Community Pharmacy Thames Valley is confident that the other pharmacies can accommodate the additional demand. In summary, the analysis showed that there would not be a significant gap in services created as a result of the closure. So there is no need to redo the pharmaceutical needs assessment or publish a supplementary statement. But due to recent issues at pharmacies across the district and in light of concerns about the cumulative impact of closures, it is proposed that the ICB be asked to prepare a report on the resilience of pharmacies across West Berkshire, and Healthwatch be approached to see if they would perform a survey of waiting times at pharmacies across West Berkshire.
Thank you. Any members have any?
Yeah,
Gary?
thank you very much. Yeah, very much. I mean, in the recent times, we've lost Lloyd's in Bartholomew Street, Superdrug in Northbrook Street, and the Lloyd's in Sainsbury's too, haven't we? And I'm pleased there is going to be a survey of the pressures and how that's impacting on people. My worry is what happens if Boots decide to go online and the impact it'll have there. And I think that I think I mentioned at the meeting we had last time about this, we need to have a sort of a situation where there's going to be at least one banking hall left before they all go too. And I think it's the same with chemists. So it is quite concerning. And for people that, and because parking isn't readily available for less able people, I'm not talking about drivers now, people that use other forms of transport, then it can be a problem for people to get to these places easily, particularly the loss of Sainsbury's and Superdrug. It's a problem.
It seems a bit bizarre the way that the needs assessment is based on distance rather than how local population or whatever. There we are. Lee.
Yeah, and I'm added to that, the closures of some of the pharmacies in Thatcham as well will mean that those on the east of the town might head into Newbury rather than into Thatcham. So again, a bigger sort of cohort. I wonder, could the report also look into the delivery model of medication in that, like you have the Amazon lockers and you have a unique code and then you go and type it in and then it unlocks and you can get access to it. And what role could that play in being able to get prescriptions out into the community where we need them?
That's a good suggestion. I believe that's being done somewhere in the region. is it Abingdon or somewhere, I think, but
Well, if we can take the best learning from across the country and deliver it here in West Berkshire, I'll be happy.
Chair, I think Downlands, the practice there at Cheveley was looking at this model. Whether they've gone with it or not, I don't know, but they seem to have very long queues there. So
I think that was the one I was thinking of, to be honest. But yes, but it's certainly something that should be looked at, because it is a bit silly. I've heard of people having to queue for an hour, and in pharmacies throughout the district. This is. And if it's just to pick up something, it seems rather crazy when you could take it out of a cigar cubicle. Yes, thank you. Sean.
Yeah, just to say that, you know, I personally welcome the proposal that's in there, because, I mean, it kind of feels like it's all going in the wrong direction. You know, regardless of the numbers and the availability. I mean, we have seen, as people have said around this table, a number of pharmacies close, and this drive towards, I suppose, online and digitisation and everything else just doesn't feel like it stacks up with some of the major users, the service users of those facilities, and the discussions that people want to have. You know, we've all stood in queues at pharmacies while the people in front are having very long discussions with the pharmacist about what is needed, what is appropriate, and everything else. And you know, you just can't do that in this kind of digital world in the same way. So when the latest one shut in Newbury, I mean, it did get me thinking about where all of this was going, given that the message for years has been go and talk to your pharmacist. You know, going to talk to your pharmacist relies on there being some pharmacists.
Thank you. Could we move on then to approving the recommendations? Oh, I'm sorry, John Ashton, sorry.
No, sorry, just listening to the conversation. I mean, I find it very disturbing. I think it's difficult to know quite what to do. But I mean, what we're looking at here, I think, is market failure. The market is not adequately responding to need here. And the needs are complicated. I mean, older people who are less mobile for whatever reason, either because they're living in rural areas or because they don't have access to transport, compounded if they don't have access to transport and they're living in rural areas and there aren't any buses. You know, these are, it really requires intervention. And the NHS needs to be overseeing the strategic dimensions of intervention, I think. That some places, I mean, if you've got a dispensing health centre, I have that where I am in the Yorkshire Dales. We have a health centre and there's a pharmacy in the health centre. There's also a small Boots along the road at the moment. I mean, that's perhaps optimal when you're in a community like I live in, but I think we need a variety of options for people if the promise of more involvement of pharmacists in primary care is to be fulfilled. So we can't just stand by, I think, and just let this unfold. I mean, the news this last week was that 300 Boots shops are going to close around the country. So I think we do need a more sophisticated kind of needs assessment. I'm conscious that some of that falls to the Director of Public Health to do. But I think when it comes to intervention, I think it's a whole system thing. So I think we really do need to have a strategic review of the whole thing.
Thank you. Perhaps that's something we can bring back to this board for a future meeting, and to actually look at the whole issue of how these needs are ascertained and so on. And I mean, last year I had COVID vaccinations in a pharmacy. If they all close, it's going to put more pressure on the GP services, isn't it? Okay. Okay.
Thank you, Chair. Yeah, so obviously we're about to come to the motion. With regard to the ask that the ICB produce a report, we're happy to take that on. I think we will need to come back with regard to the timescale, and it will depend on the scoping of the report. Clearly, there's a number of issues that have been raised today that we would want to cover alongside resilience, such as the ask of pharmacies within the primary care access space, and how this all plays into that. So yeah, in principle, happy with the recommendation from our end, but we will need to confirm the timescale if that's okay.
Thank you. Could I ask then, could I have a proposal that we accept the recommendation in the report? No, thank you.
So proposed, Chairman.
Seconder, please. Councillor Codley, sorry. Thank you very much. Thank you. Can we move on to item 13, which is, sorry? Oh, I'm sorry. Permitted to actually ask for a vote. So those in favour, please. Thank you. So can we move on then to item 13, which is the delivery plan progress?
Thank you, Chair.
And this April again, please.
Thank you. So the report is regarding the health and wellbeing strategy delivery plan progress, but specifically focusing on priority 2. So, and priority 2 is to support individuals at high risk of bad health outcomes to live healthy lives. Issues impacting groups at higher risk are lack of easy access to healthy activities and food, limited availability of information about health and wellbeing services, increased loneliness and isolation, barriers to accessing GPs and primary health services, and high risk groups, as you'll see from in the report, are those living with dementia, people with learning disabilities, unpaid carers, rough sleepers, and people who have experienced domestic abuse. The strategy sets out a number of objectives for this priority, and the delivery plan contains a series of actions to deliver these. Some of the key actions are listed within the report, and have included a creation of a young carers dashboard, improved support for homeless patients discharged from hospital, creation of a lived experience group reporting to the Domestic Abuse Board, creation of the Community Life Connected Map using a doddle. In addition, Appendix B of the report contains the evaluation report for the Developing Life Skills project. The report also sets out key activities to be progressed in 23 and 24 and beyond. A number of actions have been identified as being more appropriate for delivery at place or system level, and these will be escalated accordingly. The board should also note that we are in the process of preparing a dashboard of key performance indicators for each of the objectives, which we are discussing with colleagues at Reading. We will bring this to a future meeting.
Thank you. Do any members have any questions, please? Thank you. There's a couple of points that came up in the report that I was in. One is help the issue of young carers, which I think is a very wide space. I think it's a scandal how much we rely on young carers to look after people, and also the issue around dementia diagnosis. Because we heard at a previous meeting that we are a bit behind the curve in diagnosis. And of course, it's being increasingly realised that early diagnosis of dementia can be very helpful, particularly with new drugs coming along. So, but thank you very much. If there's no questions, could I move on to? Sorry. Oh, is he online? Sorry. Ian Wolfe is online. I would like to present as well, please.
Yeah, thank you, Chair. I don't know if you can hear me okay.
Yes, we can.
Excellent, thank you. So I was asked just to pop along today, and thank you for inviting me. Just to mention one of the projects that the Health and Wellbeing Board has supported, and that is the Developing Life Skills programme. A really useful programme, of course. It's working particularly with young people in schools, and it has worked successfully probably over the last 5 years, in fact, particularly focused on trying to develop the sorts of skills in vulnerable young people that they are struggling with at the moment, particularly around mental health, emotional health, self-confidence, and the ability to present oneself positively in life, and of course in moving on in education and in future careers. So thank you very much to the board. You have supported over the last few years the Developing Life Skills programme. It's been delivered by EBP, Education Business Partnership, very successfully. And I believe that you've seen the evaluative report for the academic year we've just finished, where they worked with around 250 young people in schools and managed to deliver this programme in most of the secondary school settings, including specialist placements like iCollege. The work is much appreciated, and the young people and indeed their teachers evaluate it very positively. It makes a real impact and a real change for those young people. And I suppose I would just take the opportunity of mentioning the fact that we'd like to do it again as the Skills and Enterprise Partnership. We'd like to support it for the coming academic year. As it stands at the moment, I believe there aren't any specific funds in the pot that are left in order to support it. And therefore, I guess our request to the Health and Wellbeing Board is whether you can identify, whether you can think of any particular sources of funding that may allow this valuable work to continue in the coming academic year. And of course, very happy to answer any questions from the point of view of the Skills and Enterprise Partnership, who have supported and sponsored this work.
Thank you. Councillor Dillon.
Yeah, thank you. Thanks for the report. In the school table summary, it's got the year group and then the number of students. So the Downs had 2 streams of that in year 9 and year 10. Did they pay extra for that?
No, the schools don't pay directly. The work that you see listed out there is the work that the Health and Wellbeing Board have provided the funds for. In actual fact, the project itself is bigger than this part that's delivered through the funding from Health and Wellbeing Board. So there are other cohorts as well that are delivered by EBP through some other sources of funding during the year. So no, the schools themselves don't pay for the individual activities.
Okay, and then the schools in question here are all in the west of the district, apart from Littleheath. And I noticed Trinity hasn't engaged here. So what was the rationale for choosing these schools and then just choosing a flat cohort number rather than a percentage of population, or looking at those who would most benefit to partake in this programme?
Yes, that's a very good question. And apologies, I haven't got the rest of the information at my fingertips because, as I've mentioned, that there is a wider programme that does deliver to other schools as well. I suspect that what EBP colleagues have done here is just to provide the particular schools for which they use this funding for. So I'm sure it sounds like it would be very helpful if I could provide that to you afterwards and get the EBP to send you through the complete list of all the work that's been done with the different schools.
Yeah, that'd be lovely. Thanks, Ian. Thanks, Chair.
Are there any other? John Ashton.
Ian, could you tell us what measures of outcome you're using, please?
Yeah, the measures are briefly listed in the report. So they're self-reported measures. So it's looking at the students' feedback as to their ratings of how they feel on certain criteria before the programme, how they feel once they've experienced the programme. And we can see in the report some very positive figures there, around 90% of students typically positively rating aspects of the programme. And then, of course, there is teacher feedback as well. And the teachers rate the experience for their students as to how effective they feel it was according to certain criteria. In addition, of course, the final acid test is where the teachers say that it was a useful thing and they'd like to do it again. In other words, whether they'd like it to continue for future cohorts. And I'm pleased to say that 100% of teachers feel that it's so valuable that they would like to for their students to engage in it in future years. So that's how the measures are done. But of course, if colleagues have got other thoughts about how to better measure a programme like this, I'm very pleased to hear those.
Thank you.
Did you want to make a point?
Not on the outcomes measuring, Chair, but what's the order of the sort of the cost of it, Ian?
Yeah, I have asked the EBP to put together their to fill in a form, basically the form that they've used in previous years, and their estimate for a similar volume of work for the coming year is just a shade under £12,000. It's a very exact figure, in fact. Let me just put my electronic finger on it. It is £11,947, which will be for 12 cohorts and around 225 participants.
I'm sure you've already thought of it, Ian, but I would have thought if there was an application by EBP to Greenham, that probably be good a chance as any, I would have thought, to Greenham Trust.
Yeah, I mean, it may be. I know that EBP do have amounts of their work supported by Greenham very kindly. In fact, Greenham are substantially funding the up and coming what's called the Destinations Expo, which has a different focus, of course, which is about young people in schools getting an opportunity to come and meet employers and indeed universities as well. And that's happening this year on the 12th of October. And I know that Greenham Trust have completely funded that this year, which is fantastic. It's quite an expensive business. But yeah, I'm sure if there were opportunities through Greenham, then EBP would probably be exploiting them already, I imagine.
Well, perhaps you could approach Greenham, and then if that's not successful, which I hope it will be, then perhaps come back to this board.
Yeah, certainly. Yeah, I'll speak to EBP about that.
Thank you. Any other points? Okay, well, thank you. The recommendations to note the report and progress made to date, and consider if actions are still appropriate. So, do we think the actions are still appropriate? If so, and then also agree the actions to be referred up to the place or system levels. So that's to the Berkshire West place-based partnership or the ICB, and commit the organisations to delivering the agreed actions. Is everybody happy with that? Right, could I have a proposal, please? Councillor Conley, and a seconder, please. Councillor Dillon. Those in favour, please. Thanks. And we move on, please, to item 14 and April again, please. Sorry, I'm corrected. This is just an item of information. So are there any questions arising out of the report for April, please? Well, thank you very much. There don't appear to be his off this time, April. And item 15, the subgroup updates. Has anybody got any issues that was to raise out of the updates or any requests for further information? Okay, well, thank you. So we move on to item 16. Do we have any members' questions?
There are no members' questions received, Chairman.
Thank you. Move on to item 17. To note the forward plan and suggest any changes or additions to agenda items to bring forward to future meetings. Are there any issues, please?
I guess, Chair, just to come back with the update in December on the cost of living discussion.
Sorry, I didn't quite catch that.
Just to come back in December with the update on where we've got to with the cost of living stuff.
Okay, thank you. Any other issues, items? Nobody online? Okay, thank you. Item 18, future meeting dates. Could I ask members to note the dates for the future meetings in the 7th of December, 22nd of February and the 2nd of May. Okay, thank you. So thank you all very much for attending, and thank you very much in particular to the officers for preparing the reports. And if I could ask everybody to remain until the live stream is finished, please.